So you've already seen your new consultation, you've identified the one thing that brought them into your space, and you've done one treatment. Maybe it was 8, 10, 20 units of talks. Now they trust you. Now they might ask you more during that appointment, or they might come back. It's really nice if you have time in your schedule as you're building your practice to have them follow up, because you get them back in your space again. So now part 2, they come back in your space and they say, oh yeah, this is a little bit better. You had set realistic expectations that it's not, you know, gonna be a dramatic change of what's happened in their face over 20, 30, 40, 50 years, and one treatment's not gonna do it, so they weren't expecting miracles. Now they're gonna come back and they're gonna say, okay, yeah, this area still kind of bothers me. I know you had mentioned something about, you know, maybe some filler in my jawline. Now you have the opportunity to start talking about structure. I hear this comment all the time with my new patients. I'm so nervous about filler. I really want to get filler, but oh gosh, this girl that I work next to, her face looks so bad. But yet they're in your space and in your chair to get filler. So they want it, they're afraid of it. Here's your open door to talk about structure support. It's so important. And as we move forward with aesthetics, we have to get away from just soft tissue. A little soft tissue is good. Little in the cheeks, a little bit in the lips is good. But what really makes people look great is structural support. Working on the bones, right? Cheekbones, jawbone. And what makes people look really bad is filler in the cheeks without the support. I would even say filler in the cheeks with bone support also looks bad, because we lift so much when we're talking and we're smiling that if we're just putting in the cheeks and we're not replacing the bone, it's just gonna look out of balance. It's just too much of that hyaluronic acid. And what we know now is that that hyaluronic acid lasts longer than what it's studied for. So just because it's a 9-month indication doesn't mean it's completely gone at 9 months. It could be there for 3 years. And even as that hyaluronic acid is breaking down, it can still hold on to lymph fluid. Step 2 is educating them. Try to keep it simple. I know I'm not good with this. I way over talk and I way over educate. I'm definitely guilty for that. But just know that keeping it simple is stupid. If you heard that in nursing school, right? Just try to keep it as simple as possible. It's always about highlighting jawline structure. So even if you're treating somebody who's in their 30s, really important if you're treating someone in their 50s and 60s, you have to have the support, because just putting soft tissue filler in the face, one, if they're young, they don't need it. They still have some of that facial fat that's giving them that padding. And if they're old, their bone is already breaking down. So you have to give support so that when you put filler, it just doesn't make it heavy. Same goes for the tear trough. Same goes for the lips. If you're doing lips, you have to have structure in the area around the lips so that it just doesn't look odd and it doesn't look unbalanced. When you're assessing their face, put your hands on them. Like, what does their bone feel like? Look at them from the side. Let them look at themselves from the side. Like, do they have that structure in their jawline? Where is their chin lining up to their nose? And start there. And just make sure you tell people, like, hey, we're going to take it slow. This product lasts longer than what it's studied for, and everyone's a little bit different. So let them know it's going to be a buildup over time. You're going to layer product. Everyone wants to know, well, how long does this last? This is not like Motrin, where after 6 hours it's completely out of your system. We don't know the half-life of hyaluronic acid filler. It's an unknown. It's different for every person. We don't put people on schedules for filler. We just do it slowly, right? So step 1, treat the reason why they came in. Step 2, start to talk to them about structural support and let them know that that is the way to do aesthetic injections without looking overdone, without looking fake, and without looking out of balance.